Welcome back to AM Live, and I'm here with the lovely Ashley Riley. Good morning.
Good morning.
The lady with the beautiful smile.
Oh, thank you.
And it's natural, too. It's
Yes,
beautiful.
it is.
It's beautiful. Ashley, one thing I want to point out that's very, very important that you have also stated many, many times is that oral health and your overall mouth, that can really affect your physical health, including even having problems with your heart and having events with your even blood system.
Absolutely. There's been a lot of research over the last couple of years where they're showing that people that actually have had atherosclerosis, or they actually go into the arteries and they're cleaning them out, that plaque that they're finding in the arteries is actually plaque from the mouth. And it's not just that this bacteria, which is basically plaque, that's living in two different parts of the body. It's coming from the mouth, getting into the bloodstream, and cementing itself in these arteries. So you want to be very, very careful.
Well, they tell you since you were a little kid, you have to brush twice a day, and now it's even more important. You need to floss. It's important.
Yes.
The mouth is probably the dirtiest part.
It is.
It is. It's filthy, and if you don't take care of it, you'll get sick.
Yes,
and
you will.
And you'll lose all of your teeth. So show us the importance of flossing and the proper way to brush.
Perfect. So yes, you want to do at least twice a day on your brushing, and at nighttime is one of the most important times, actually, because when you're sleeping, your mouth is moist, it's dark, it just creates this perfect environment for that plaque to just multiply, leading to tooth decay, periodontal disease. So what you're going to do when you're brushing is actually, and this is a very large brush, but you want to do a 45-degree angle along the gum line.
Okay.
So a lot of people tend to brush with the brush directly on top of the teeth when you actually want to angle down at about a 45-degree angle into the gum line. Because that is where, at the gum line and underneath, there's a little space between the gum and the tooth where the bacteria actually sits and will start to build up. So if you can keep this area clean, you're going to keep the pockets clean and the teeth clean.
Now, is that where like pyorrhea would set in and start in? Or
Yes.
Is that lower?
No, that can actually start even just within the few millimeters underneath the gum. Now, when you have periodontal disease, you're actually going farther and deeper, and when you can actually not access that area with the brush itself. So you have to be able to angle the best you can. And you're going to work that brush all the way around the mouth, so from front to back, and then even along the inside the best you can.
Okay.
With your electric brush, it makes it really easy. You just angle, turn it on, and go.
Now, if you have a partial, like
Partial,
I do,
yes.
make sure you take that out and that's cleaned every day.
Yes. You want to take it out, and actually you're going to let the tissue breathe for a while. So you're not just going to take it out while you're brushing. Hopefully you're leaving it out overnight for a few hours, keeping it clean. But that tissue needs to be able to breathe, because you actually can get infection and thrush underneath that partial.
Okay, great. Yeah. Don't stick them in the dishwasher.
Do not stick them in the dishwasher or your toothbrushes either. People do that. The other thing is going to be really important is flossing. And now the toothbrushing cannot reach every area around the tooth, especially down. There's certain pocket depths down in there that the plaque will sit that your brush and your floss can't even reach, but you need to do the best you can. Okay. So what you're going to do is you're going to do a little seesawing motion to get that floss down into the gums without having to actually shred the gums. A lot of people pop it down in there and cause abrasions. But once you get it in, you're actually going to do a C shape, what we call. You're going to try to, the best you can, pull the floss around the front and the back sides of the tooth. And once you do that, you go up and down about 4 or 5 times. Stay in the same pocket area and go over to the next tooth and go up and down about 4 or 5 times. But there's no need to apply extra pressure or abrade the gums.
Now, Ashley, they tell you that you should always brush with a fluoride toothpaste.
Yes.
Am I correct?
Yes.
Is there, I know you can't endorse one over the other, but are there some that for parents, when their children start brushing, and that's usually around, what, 3 or 4 they can start brushing, or earlier?
They can brush earlier than that. You're going to start to get your teeth, the baby teeth, around 6 months. Now, usually at that age, you don't want to be using fluoride toothpaste because most kids don't understand not to swallow the toothpaste. Okay. So you want to make sure that you're using one without fluoride, and up until about 3 years, you can start, but you really want to monitor them and make sure they're not swallowing. But most toothpaste, it's all the same fluoride that's in there. So as long as it has fluoride protection, you're getting that topical protection on the tooth.
Great. That's very, very good. And remember that good hygiene, dental hygiene, will help protect the teeth that you have.
Yes.
And it's very, very important because it can affect your whole body, and especially teenagers, because they eat a lot of junk.
Yeah.
and a lot of soda, which you have to learn to rinse your mouth after you drink soda because that starts
Absolutely.
the decay process.
Yes.
A lot of people think diet sodas or whatever, but just the fizz and everything, it starts breaking down the enamel. Am I correct?
It does. Any acid on the tooth, acid exposure, is what's going to actually start. The plaque feeds off of that, and it just creates even more acid as a byproduct, and it just eats right into the
Right.
root surfaces and the enamel.
Great. So remember to take care of your choppers, and you'll have a lovely smile like this. This reminds me of Ahmed for some reason. Silence! I kill you. Anyway, we're gonna go. We're gonna go over to Mike and our next guest. Thank you, Ashley.
Absolutely. Thank you.